Welcome to a very short tutorial, a video, if you will, of a FAST exam. Ultrasound is an amazing tool that we can utilize both in the hospital and now pre-hospitally. The military is also utilizing it on the battlefield to do exactly what we're utilizing in the civilian world pre-hospitally. For a long time, we've had to utilize our hands, our eyes, our ears in order to figure out what internally was going on with our patients. But now, with diagnostic tools that have moved out of hospital facilities and into the back of ambulances and into helicopters, we now have the ability to help delineate a patient to the most appropriate facility based on their needs. What you're looking at right now is a drawing of a patient's torso. The first picture at the top is of the heart. Now the image is upside down. This is the image of what we would be seeing in an ultrasound, but I'm going to point out some aspects that we're looking for in this heart to help us determine whether or not there's some internal trauma that's going on. Down over here, if we're looking at the patient's right side of the body, we'd be looking at a portion of the liver, is what you're seeing here, and then the right kidney. Moving over to the other side of the body, we have the left kidney, and a rather large organ on the left side there is the spleen. And then if we move down to the middle, you'll see that we're more in the pelvic region. This would now be the bladder. In a FAST examination, focused assessment for sonography and trauma, we are utilizing ultrasound waves to help us determine whether or not a patient has internal bleeding. In the protocols that we follow, any one of these four sites that have any amount of blood in them would be an immediate trauma alert. And this patient would now no longer go to the nearest primary care facility, but rather would go directly to a trauma center, normally via helicopter. Why do we do that? We're doing that because the patient has what's known as the golden hour running against them. It's basically a clock that if we don't do something surgically to help stop this bleeding, the likelihood of them dying is high. In the old days, we wouldn't have had ultrasound in the field, and so therefore this patient would go to a primary care facility. They would ultrasound them there, maybe 20, 30 minutes into the golden hour, realizing that this patient is in the wrong facility, would then be transported, sometimes an hour away, even by helicopter, to a facility where they could do something about the injuries. Well, of course, then it's probably beyond that golden hour, and for a lot of these patients, too late. So what are we actually looking at when we're looking at a FAST examination? Everybody knows what an ultrasound is. Most people see ultrasound when it comes to the world of labor and delivery. OBGYNs use it all the time to see the state of a baby. But in this case, let's take a look at what's going on with the heart. If I expand this picture out, and let's move it over here to the side so you have a better understanding of what I'm looking at, right away you are going to notice that there's something not quite right about this heart. The heart looks okay, but if you notice that there's this lining right here that's following along the outside of the heart is known as the pericardial sac. And the pericardial sac should actually be nice and tight right inside by the heart, and it should follow right along. But instead, what's going on here is this pericardial sac is kind of bulging away from the actual heart. Again, the pericardial sac should be nice and tight inside of here. You notice that there's a big gap all the way around the heart. This is what's known as tamponade, cardiac tamponade. This is all blood. This big black gap in ultrasound, when you see these big black spaces like this, is a sign that there's actually free-floating fluid inside. And so in this case, there's blood surrounding the heart. When there's blood surrounding the heart can't beat appropriately. This would be the primary site for a FAST exam. We're going to look here first. If we see any blood, it's an immediate trauma alert. This is going to kill them the fastest. Let's go over and take a look at the right side. The right side of the body, when we look at it, this space is known as Morrison's pouch. The large figure here is actually the liver. And this bean looking guy here is the kidney. But what we're most concerned about is this black. Again, you see that black that's occurring right in between that. And this is Morrison's pouch. That is a sign that we also have blood. This would be a positive trauma alert. This patient should be taken to the nearest trauma facility and not to the nearest hospital. Let's continue on. And I'm going to move this guy now to the center so it's a little bit easier to see. And let's expand him and see what's going on. In this case, what we're looking at is the spleen. This large organ is the spleen. Again, the bean is the kidney. And once again, you notice that there's a large black area that's running right through the middle of this. When you hear of people having what's known as a cracked spleen or maybe a cracked liver, you generally hear that in situations where they were involved in a car accident. Imagine being hit, T-boned on the side of the vehicle, on the left side or on the right side of that vehicle. Having a hit like that can cause these types of injuries, the green being the free-floating blood and the damage to the spleen and the kidneys. Or if we get hit on that right side, the liver and the kidney. There's one other area that we really need to focus in on, and it's an area that a lot of people tend to forget about, the bladder. So this guy right here can actually hold quite a bit of blood. In the areas of the bladder, what we'll often see is blood will sometimes form on the outside, but you can also get blood forming on the inside. So this is our fourth region of the FAST exam. So remember, what we're looking for is a quick assessment of all of these regions: the heart and the tamponade that can happen, the liver and the kidney on that right side of Morrison's pouch, the spleen and the kidney, the splenorenal area and the blood that can accumulate, that dark area right there, and the bladder. If we have a positive sign in any one of these four regions, we're going to delineate that in our protocol as a trauma alert and immediately get this patient to the most appropriate facility, our trauma center. I hope this helps. If you guys have any questions, feel free to call the Academy and the Education Department. We're here to help you. Thanks for watching.